Imagine waking up every morning with breakouts you just can't explain, or redness that just won't go away, or itchy skin that just drives you bananas. You've tried every lotion, potion, and skincare hack out there, but nothing seems to work. What if I told you that the problem might not be your skin at all, but rather your gut? That's right. Today, we're diving into the fascinating connection between SIBO, small intestinal bacterial overgrowth, and how it could be wreaking havoc on your skin. And trust me, this is one connection you need to know. Hi, I'm Michael Arthur, otherwise known as the Mind Belly Doc, and welcome to the channel where we talk about all things gut related because all health, good or bad, begins in the gut. Let's face it, skin issues aren't just about appearance. They affect your confidence, your mood, and even your mental health. And as someone who's been through my own skincare struggles with vitiligo, I know how frustrating it is to try everything without results, to seek doctor after doctor, to use cream after cream, to take supplement after supplement or medication after medication, and even use specialized therapies like UV treatments. But here's the game changer. For many people, possibly even you, my friend, the answer lies not in creams or treatments, but in healing your gut. Let's talk about SIBO and how it could be the key to unlocking healthier skin for you. First, let's talk about what SIBO actually is. We won't take a super deep dive here because we've already done that in another video called Is it IBS or is it SIBO? And you can check that out with the link above. But for now, let's just cover the basics. SIBO stands for Small Intestinal Bacterial Overgrowth. Sounds fancy, but here's what it really means. Your small intestine, which is supposed to have only a small number of bacteria, suddenly gets overcrowded. It's like hosting a quiet dinner party and then everyone you didn't invite shows up with their friends. Total chaos. These bacteria cause all sorts of digestive issues. Think bloating, gas, and stomach discomfort, but here's where it gets interesting. SIBO doesn't just mess with your gut, it can mess with your skin too. So, how does something in your gut show up on your skin? Well, it all comes down to inflammation, my friend. When you have SIBO, those extra bacteria produce byproducts like toxins and gases. Your body tries to fight back, triggering inflammation. And this can show up on your skin as acne rosacea, eczema, or just that overall meh look we all dread. Ever heard of the gut skin connection? Well, this is it in action. Your gut and your skin are basically BFFs. They're constantly talking to each other through the gut skin axis. So, how exactly does SIBO mess with your skin? Well, here's the nitty gritty on what happens. SIBO bacteria produce toxins that can leak into your bloodstream, triggering inflammation everywhere, including your skin. The pathobionts that cause SIBO interfere with your body's ability to absorb key nutrients like zinc, vitamin A, and essential fatty acids, nutrients that your skin needs to stay healthy. SIBO additionally disrupts your body's natural detoxification processes, leaving waste products to build up. And because the skin is another mucous membrane, just like the lining of the digestive tract, it will help to detox the body whenever the GI tract is overwhelmed and can't keep up with managing all of the inflammation and toxicity. These toxins and all of this inflammation shows up on your skin as redness, breakouts, irritation, or worse. It's like a perfect storm for skin issues. And the worst part? Topical treatments can't fix this because the problem is coming from the inside. Well, here's where it gets fascinating. SIBO doesn't just cause one type of skin problem, it's linked to a whole range of them. Let me break it down. Let's start first with rosacea and acne. Research shows that treating SIBO can significantly improve rosacea symptoms. I've seen patients with persistent redness and acne clear up after addressing SIBO. Now, the healing of the skin usually happens in the 3 months after we've healed the gut. The delay in the healing of the skin can be daunting, but the results are so worth it, especially if you're feeling better and have more confidence because your skin and your gut are behaving. Second, let's talk about eczema and psoriasis. These conditions are often driven by inflammation, and SIBO can make it harder for your body to fight back. Third, perioral dermatitis. That rash around your mouth might not be a topical issue at all. It could be SIBO. Fourth, keratosis pilaris. Those tiny rough bumps on your arms, the back of them, and your legs, they can sometimes be linked to poor nutrient absorption caused by SIBO. Fifth, seborrheic dermatitis. This flaky, scaly condition often improves when gut health is addressed. I've seen cases of seborrhea linked to both SIBO and SIFO, small intestinal fungal overgrowth. And fifth, but certainly not least in my mind, is vitiligo. While healing SIBO may not reverse vitiligo, healing your gut can slow its progression and reduce the inflammation. I've seen this firsthand with my own vitiligo and my own SIBO. I once had a recurrence of SIBO, and during that time, my own loss of pigment went on some crazy fast forward double speed journey. It was alarming to see how quickly my skin was changing. But once I got the inflammation from my recurrent SIBO down, the loss of pigmentation also slowed down. I didn't get back what I lost, but at least I didn't lose more, and the vitiligo took a pause for a while. Now, let me share a quick story about one of my patients, Marjorie. She was 54 and had struggled with severe rosacea for years. She tried every cream, diet, and medication under the sun. Nothing worked until we tested her for SIBO. And sure enough, it was the root cause. Now, after treating her SIBO and healing her gut, her rosacea improved by 80% in just 6 months. She's now confident, going makeup free, something she never thought she'd be able to do. If you think SIBO might be behind your skin issues, here's what to do. Get tested. A simple breath test can confirm if SIBO is the issue. Don't guess, just test. There are links in our description below on how you can get your hands on a 3-hour breath study. Be sure to check it out. Follow a gut healing protocol. Work with a healthcare provider to use diet changes, antimicrobial treatments, and probiotics. Nourish your skin from within. Focus on whole foods, stay hydrated, and consider supplements like zinc and omega-3s. Manage stress. Stress can disrupt both your gut and your skin. Practice mindfulness, get good sleep, and avoid skin products that overscrub your skin or that contain harsh chemicals that can make inflammation and redness worse. Your skin is like a mirror. It reflects what's going on inside your body. If you're dealing with stubborn skin issues, it's time to think beyond the surface and get to the root cause. And SIBO might just be the answer you've been looking for. If you've been feeling stuck with your skin health, don't lose hope. Healing takes time, but it is possible, and the results can be life-changing. If you found this video helpful, give it a thumbs up, subscribe for more tips like this, and share your story in the comments below. What's one skin issue you've been struggling with? Let's talk about it. Now remember, healing your gut is the first step toward healing your skin. Gut first, skin second, and the glow will follow. Be well, and I'll see you in the next one.